And we're going to start with the breast. And you are an expert and you focus your practice a lot on breast augmentation and reconstruction. But let's first talk about silicone breast implants. Are they safe or not?
They're pretty safe. They're obviously saline implants, if you really think about it, is probably safer than silicone because it's saline. But silicone hasn't been shown to cause most of these problems that it's been accused of. In fact, the saline implants, the outside shell, is made out of silicone. So even a saline implant does have silicone in it. It's just the inside material is either saline, which is just salt water, or silicone gel, which is more like thick honey. So it hasn't been shown to cause most of these issues that it's been accused of. The studies are still going on, but so far so good. It hasn't been shown to cause any of these issues.
So if a patient has a breast augmentation with a silicone or a saline implant and the implant breaks or deflates, if it's saline, you're saying it just dissolves back in the body, but if it's silicone, it's more controlled now than it used to be?
Right. Basically what happens is that the saline implants, they do get a hole in them eventually. All these products break down. So they're all man-made objects, and as time goes on, they have what they call a shelf failure, which is similar to if you have a credit card and you keep bending it, eventually gets a little crack in the corner. And same thing happens with the implants, is that they basically form a tiny little hole, and if it's water, it's just a water balloon. It just leaks out. Many times patients have no idea. They go to bed, everything is great. They wake up in the morning and one breast is smaller. So that's actually one of the advantages of saline implants over silicone gel, because you can tell if your implant has failed or not. The breast basically just gets smaller in volume on that side. Silicones, on the other hand, the silicone, as I said earlier, is more gel-like. So if you get a tiny little hole, nothing really happens. A little may get out, but it doesn't mean anything. And if you have a frank rupture, which means if you get the implant, actually just cut it in half, the new silicone gel implants, basically, they don't leak like the old ones. The silicone doesn't go around. The old ones were more like honey, almost like getting a spoon and pouring the honey. It was more liquidy. The new silicone gel implants are more thick. Their viscosity is different. As a result, even if the implant ruptures, the silicone stays around, stays within the pocket, and they're almost like have this gummy feeling to them. So as you pull on the silicone, they just pull back. So it just wants to hold on and wants to be cohesive and hang on and not travel anywhere.
So that's what makes them safer than the older silicone.
Oh, definitely, yes.